Hi, my name is Jen Cochran. It is my pleasure as a certified lymphedema therapist, movement specialist, researcher, nationally board certified health and wellness coach, and breast cancer survivor to talk with you about breast cancer related lymphedema on behalf of Casting for Recovery. We've created a 3-part series for you to talk about the basics of breast cancer related lymphedema, the fact and fiction of breast cancer related lymphedema, and how to curiously puzzle out the fact from the fiction. And finally, how to approach exercise with an eye for how to make it work for your body in its post-treatment place, wherever that may be. Welcome to part 1, the basics. Every breast cancer survivor who's undergone one or more treatment modalities has a risk of developing breast cancer-related lymphedema in their lifetime for the rest of their lifetime. And this condition does not have a cure. If it occurs, it will need to be managed for the long term. The good news is, if we catch it early and take steps to manage it, the effects can be minimized. And for that reason, education on what it is, how to recognize it, and what to do to manage it is important information. Let's start at the beginning. What the heck is breast cancer-related lymphedema, and why does it matter to me? Great questions. Basically, the lymphatic system is part of the immune system. It works alongside your circulatory system to move protein-rich fluid through your body, removing waste products from the space in between your skin and muscles along the way. Think of the flow of lymph like waterways flowing through the body, facilitated by collection stations that gather and process waste. The collection stations are the lymph nodes. The lymph nodes occur in groupings throughout your body. See these green lines and groupings here? These represent your lymphatic system. The lymph nodes pick up that protein-rich fluid from the waterways and move it along the system until all the waste is processed out. Secondary lymphedemas, like breast cancer-related lymphedema, can occur when the lymphatic system experiences an injury of some type, causing a backup in the flow of lymph, which can result in swelling. In the case of breast cancer-related lymphedema, this may be a side effect of surgery, radiation, and/or chemotherapy. There's some disagreement in the research regarding how common breast cancer-related lymphedema really is, which may be impacting the education we receive as patients. The number currently ranges from 0 to 87% across 2 decades of studies. In my opinion, this is really more of a dartboard than a rate of incidence. In fact, several recent studies have commented on the fact that in other conditions, this level of variation is simply unacceptable. In my research, I found this disparity may be happening for a couple of reasons. First, breast cancer survivors are typically not screened early enough for this condition, and not having those pre-treatment measures may be resulting in an underdiagnosis rate of 50% or higher at early stages, which is resulting in greater levels of disability when we are diagnosed at later stages. In addition, there's a discrepancy between when we begin treatment of breast cancer-related lymphedema as a certified lymphedema therapist and the tripwire for reported diagnosis in the research setting. So we begin treatment when the arm has changed in size by 3% or greater compared to baseline measurements, or when compared to the unaffected arm. The research is currently reporting a positive diagnosis when there is a 10% or higher difference in size. The good news is, since the research is starting to call this out plainly, hopefully that means we're moving in a better direction. While the rate of occurrence remains something of an unanswered question, The research is getting very clear on what factors increase our risk for developing this potentially late occurring long-term condition. So let's talk about risk factors. Did you have sentinel node biopsy or axillary node dissection? Taxane-based chemotherapy treatment like Taxol or Taxotere? Or radiation? Each of these can increase your risk of developing breast cancer-related lymphedema. Additionally, there are post-surgery conditions which may be indicators you have an increased risk. A seroma, which is a pocket of fluid that builds up near one or more of your surgical areas, commonly in the armpit, sometimes called the axilla or the axillary window, swelling of the arm or torso, or axillary cording, which may be visible in the axillary window, and it may feel like a ropey cord that restricts how much you can move your arm, and it may run all the way down the arm. So most recently, there's evidence that those who chose not to do reconstruction appear to have an increased risk for breast cancer-related lymphedema. So this last one is a new finding within the literature, and there is no clear why that has been speculated on. So if I were to put on my massage therapy hat, without reconstruction, the skin is healing very close to the muscle and bones of the rib cage. And this can result in more scar tissue developing during that healing process. So more scar tissue can create adhesions that then impede the lymphatic flow. So this is just one possible scenario of how not doing reconstruction may increase your risks for breast cancer-related lymphedema. But I'm sure that there's more research that will be on the way in this area since it is a very, very new finding. Now you may be thinking, but wait a minute, I'm not exactly sure if any of that applies to me. And you're not alone. We see it a lot on the paperwork Casting for Recovery participants fill out, especially regarding types of chemo and lymph node removal. There are a few places where you can find this information. First, if you happen to have your pathology reports from surgery, maybe in a folder somewhere, or in your electronic medical record, you can take a look and they should have the information about how many, if any, lymph nodes were removed. In some cases, your doc may not know until the pathology comes back how many they removed because lymph nodes can be teeny tiny little things. So second, if you don't have your reports, you can ask your surgeon or your oncologist. Really, any member of your medical team should have gotten those reports and can find the information for you. At a high level, risk for breast cancer-related lymphedema exists if you've experienced any of these items, and the risk increases significantly if you answer yes to more than one risk factor. Now let's talk about the symptoms. If you have visible swelling that does not subside within 6 to 8 weeks following surgery, and you have not been assessed for lymphedema, persistent swelling is a significant symptom where you should be referred for assessment. This may also be accompanied by what is called pitting edema. If you have swelling in your arm and you press a finger into the flesh, it will leave a pit that takes time to fill back in. In addition to visible swelling, there are 8 other common symptoms that are reported by patients that may indicate early breast cancer-related lymphedema. Pain, heaviness, swelling or tightness, loss of strength, nerve symptoms like tingling, burning, or pins and needles, skin problems like slow healing cuts or scratches, a reduced ability to raise your arm or use it for regular daily tasks. These are all symptoms worthy of being assessed for breast cancer-related lymphedema. And I just want to note here as well, swelling or tightness may be intermittent. It may not be constant. It may be here today, gone tomorrow, back the next day. That's also worthy of being investigated. So you want to be assessed if that's occurring. There are some simple actions we can take starting today to reduce our risks and maintain or improve the health of our affected arm. The first is good skin hygiene. This includes nail and skin care. Keeping the skin moisturized and protected from the sun is so important. Also, covering any cuts or abrasions and avoiding sunburns are very important precautions to take as well. Second is tending to bug bites. Avoiding them is better, but sometimes it's just unavoidable, especially when we spend time outside. A mosquito bite or a bee sting on the affected arm can put us at risk for a skin infection, also called cellulitis. If you notice that cuts or bites take longer to heal on your affected arm than they do on other places on your body, your lymphatic system could be impaired. It's possible for it to be impaired and not to have visible swelling. However, an infection could cause a slight case to become a more significant case of lymphedema, resulting in more chronic swellings. So knowing what skin infections might look like is really important. So a skin infection, often called cellulitis, may start with a red area that appears to have distinct edges. Think of a map. Country borders have edges. They may be irregular, but there's a distinct edge. If the area feels warm and the edges are growing, you want to see your doctor as soon as possible. So you can even take a pen. If you're not sure if it's growing, you can take a pen and trace the edges and see if it moves beyond where you marked. So back in May, I was bitten through my compression sleeve by a mosquito. As the week went on, the area started to get larger, itchier, and was warm to the touch. So after a trip to my doctor's office, I was prescribed antibiotics. And after 2 rounds of antibiotics, the infection fully cleared up. This was a really small bite, and it was addressed within the week. It's important to address any situation like this because this type of skin infection can progress quickly, covering large areas and cause fevers and other flu-like symptoms. If it's not properly addressed, cellulitis can require hospitalization to treat. So remember, your skin is your largest organ. We want to take really good care of it. And finally, avoiding extreme heat like hot showers and hot tubs is also recommended because the heat can naturally cause swelling, and if the lymphatic system is impaired, that swelling may become worse. Now you may be saying, hold on, I have 1 or more of those treatments. I have some mild symptoms, or maybe you have experienced a slow to heal cut on your affected arm, but you've never been assessed for breast cancer related lymphedema. How do you get screened? This is a great question. The best option is a certified lymphedema therapist. Now this may be a doctor, a nurse, a physical therapist, an occupational therapist, or a massage therapist, all of whom should have received the 135-hour minimum specialized training to become a certified lymphedema therapist. You can find one in your local area by checking your insurance listings for participating providers, asking one of your cancer specialists, your oncologist, radiation oncologist, breast surgeon, or plastic surgeon, or by simply Googling for certified lymphedema providers in your area with the initials CLT after their name. The Norton School of Lymphatic Therapy and the National Lymphedema Network both have directories for locating certified practitioners. So once you locate a specialist, here are a couple of questions that are good to ask. Do they have experience working with breast cancer survivors? If it's a massage therapy practice, confirm that they have a CLT certificate. As a massage therapist myself, I often meet licensed massage therapists who advertise lymphatic work, but who are not CLTs. And there is a difference between massage therapy, lymphatic work performed on a healthy lymphatic system, and the work performed by a CLT on an impaired or potentially impaired lymphatic system. Unfortunately, massage therapists do not necessarily know that there is a difference, so we as consumers need to be a little extra educated. This brings us to the end of breast cancer-related lymphedema, the basics. Check out video 2, where I'll be talking about the fact and fiction of this condition, how to discern the difference, and why this can be a bit of a moving target, and the do's and don'ts of managing the risks. Or you can skip ahead to video 3, exercise, getting and staying moving. Thanks for watching, and if you have questions, please feel free to reach out to me.